Hello everyone and welcome to the webinar, Preparing Your Team for Success, Strategies for Implementation Planning. Now to introduce our speakers today. With more than 25 years of public and private sector child welfare experience, Will Hornsby's work has focused on implementation science principles, systematic problem-solving approaches, and assisting state and local agencies in monitoring their child welfare programs. With more than 30 years of experience in working with state child welfare systems, Joan Nelson-Phillips is a CQI and practice improvement expert consultant. With more than 30 years of experience in child welfare at the state, local, and national levels, Mona Davis's work has been concentrated in the areas of family engagement, resource parent recruitment and training, various program development, strategic planning, federal reporting, implementation design and change management support, and capacity building. I will now turn it over to our facilitator for the day, Nicole Barnes.
Thank you, Chris. I'm going to start off today and just kind of do a quick overview of our agenda for today. We'll review our objectives next on the next slide, and then we will do a quick overview of the change and implementation process. Then we have three core sections today: preparing for implementation planning, planning for capacity building, and then implementation plan development. And then we will do some common challenges and potential strategies to get through those common challenges. And then we'll move into our small group breakout discussion session. So our objectives for today is really to help you identify the tasks in preparing for implementation planning, planning for capacity building, and developing a work plan, to identify some strategies to effectively prepare for implementation planning, identify activities that incorporate readiness and capacity building strategies into those plans, and then activities that support the development of a comprehensive implementation plan. And then, of course, our goal is to connect you with peers on ways to increase capacity to identify those strategies and activities. So let's get started. I want to give you a quick overview of the Change and Implementation series. As you can see on the slide here, you may be familiar with this visual, but this is the center's approach to change and implementation. And we have a series of eight briefs being developed. The first ones are already available on problem exploration, theory of change, intervention selection, design and adaptation, as well as readiness and teaming. The implementation planning and capacity building brief is currently available on the website, and then all of the topics that you see here will have a brief as well as complementary resources including videos, discussion guides, and of course the knowledge and skills events as you all are participating in today. Today we are talking about the process of planning for implementation and building agency capacity to really implement and sustain new programs, policies, or practices. As shown in the graphic, implementation planning and capacity building really should come after a thorough problem exploration where a root cause is identified, after a theory of change is developed, and after an intervention to address that problem has been selected, adapted, or designed. This really will help the agency to identify any needs or gaps in their capacity to implement that specific intervention and those activities that will prepare both the intervention and the agency for successful implementation. As with all of the steps in the process, having a diverse team that is a representative of all stakeholder groups and understanding where the organization is in its readiness for change in general and also for the specific intervention really are integral to successful change efforts. So the implementation planning and capacity building brief has 8 steps or essential functions, and it's divided into 3 parts. That includes preparation, planning for capacity building, and then the development of the implementation plan. We'll do a quick overview of those 3 parts and the steps within each, and then we're going to have an opportunity to hear from our expert consultants doing this work in the field on some successes and challenges with planning for successful implementation, really thinking critically about readiness and what areas of capacity are needed to implement interventions, and in developing a comprehensive work plan that outlines the actions the agency needs to take. So we want to get started this morning to hear about your experiences with selecting interventions for change efforts. And so we're going to move into a quick polling question. I would like to hear from all of our participants today. There will be 2 questions, and you'll have an opportunity to answer both. The first one is to tell us a little bit about your experience with preparing for and developing an implementation plan for a program, policy, or practice. We just want to get a handle of who we have on the line today with us. And then the second question, you have an opportunity to actually type in a short answer. For those who might like to answer twice, you are welcome to, but it will only record one answer, whatever your last answer is. So just so you know. And it is anonymous. While we can see the results live, we do not know who has answered what. So with the first question, it looks like we have a lot of people on the line that have at least some experience. And a few of us that have a good amount of experience or even a lot. So that's good. At least we've got a good foundation. And some will be learning new, and that's okay too. So what challenges have you all encountered in developing those strategies to build capacity? So I see lots: getting buy-in, too many competing projects, having the resources, definitely. Stakeholder buy-in, yes. Leadership change, yes, that's a common one that we have encountered for sure. Continuing to move forward when the intention of the organization changes to the next big thing and being able to stay focused. Yes, absolutely. That's definitely a challenge. Having the resources to implement with fidelity. Definitely. Multiple leadership changes, yes. Silos, working in silos, definitely. Okay. That's great. Thank you all for participating in the poll today. Definitely nice to hear the nice mix of folks that we have on the line today who are going to be learning with us. So we'll move on to continue our presentation. So I'd like for you all to think about a time when you were involved in implementing a new program, policy, or practice. And we heard from the poll that a lot of you have. And you've put a lot of time and effort into an implementation plan. You began to roll out the plan, and then a major shift happens. Either another urgent initiative comes through that takes priority, or sometimes even the plans are just not showing the results that were anticipated. And then the program implementation effort is either withdrawn or canceled. It can really feel defeating to put that much time and effort into something. And in retrospect, how might you be able to use that work or even some lessons learned from those challenges to better prepare for future efforts? So we know that implementation and planning can really seem to be a daunting and sometimes intimidating process for state agencies. But many have done the best that they could with limited or no support, even doing something as simple as outlining a process for how to accomplish the work. In one recent experience, a state received comprehensive training and technical assistance with implementation planning. And although the state had a process for developing their plan, their exposure to more recent science in this area has kind of shifted their implementation planning efforts and also their approach to other areas in the change and implementation process, like problem exploration, readiness assessing, and their preparation. And that shift has really evolved into normal practice among their leadership team. So the implementation plan really tells the story of how implementation of the intervention is intended to go and outlines the supports as well as potential challenges to a successful implementation. A comprehensive plan will help teams get the big picture view of all of the various parts and identify how they'll complete them and also who will be responsible for doing it. The implementation planning and capacity building brief outlines some common elements that teams should consider integrating into their plans, including background and contextual information such as the team's theory of change and any timeframes or requirements that might impact decisions, an overview of the selected intervention that outlines the purpose of it and the underlying principles, a clear description of the implementation team members, the teaming structure, and roles and responsibilities, readiness assessment findings, particularly those that are relevant to that specific intervention. Of course, the work plans, a core tenet. Those work plans should outline the activities that the team will take to get the agency and the intervention ready, as well as activities that will support testing, staging, and final implementation. Probably some preliminary thinking, really, around how the implementation plan will be monitored and the data that will be needed to adjust and make improvements. And then really thinking about how the team will engage internal and external stakeholder groups in the planning and implementation process. And how will they communicate about the progress? as well as any anticipated challenges and how they might address them proactively. So it's important to note that many elements of the plan will be based on work they've really already done through earlier steps in the change and implementation process. And deciding which elements teams include might be influenced by the type of intervention being implemented. For example, a new program or practice model with youth or families really might require different elements than new legislation that requires a shift in policy. So we'll get into kind of some of the steps. As teams begin to pull together that plan, they should really think through internal and external factors that might affect implementation and their implications. Things like relevant deadlines and timeframes based on their state statutes or policies, as well as federal regulations, their annual planning, as well as grant requirements. They should also consider whether the intervention is a replication, adaptation, or even a new design, and whether there's any existing evidence base, and what that might mean for any testing or piloting, as well as gathering feedback and data. They also should consider the level of risk to the agency and the target population if for some reason the intervention is not implemented well or if it doesn't produce those expected outcomes. They definitely want to consider their stakeholder expectations and then any other factors that might influence implementation, as well as piloting, staging, and all of their evaluation decisions. Teams should revisit their team members and teaming structure during this planning and really considering if there's a different set of skills or expertise needed to do the work of implementation. And is it different than what was needed during problem exploration or theory of change? Teams should look at who will be leading the effort and approving of key plan activities, as well as who will be key decision makers at their pilot sites, what role system partners and other critical stakeholders will have on the core implementation team or subteams. There might be new sub-teams needed to carry out certain tasks, such as teams who can develop capacity building strategies or teams to design fidelity assessments. And they'll want to ensure that the target population is represented on the team. For example, if the intervention is targeted at youth, are there youth represented on the team to offer their perspective? The team charter and communication plan should be updated based on the needs identified during this process and should be revisited regularly throughout to adapt as needed. For example, while a design team may be necessary early in the process to kind of complete the design of the intervention components or even the structure of implementation as they envision it, as that process unfolds, sometimes that subteam may no longer be needed and those team members can move back into other areas of work or maybe they join other subteams as implementation continues. So I'd really like to stop for a few minutes and let you listen to our experts that are with us today. So I'm going to turn things over to Mona, but I want to kick it off with a question. So Mona, in your experience, for the preparation part of implementation, how much of that work that needs to be included is already done?
Thanks, Nicole. As you mentioned earlier, often most of the preparation is done. The previous work lays the foundation for identifying the work plan action. I used to keep a running list of activities, and I know many states do, but I would keep a list of running activities that would come up as we completed the problem exploration, developed the theory of change, even in assessing readiness. When states are discussing these or groups are going through these processes, a lot of questions come up, and we find ourselves asking questions, how we assess our own system. Often it sparks things that we would need to think about or begin to think about when we get to the implementation phase. So I always tried to make sure that I kept a running list of all those things that would come up so that when we got to this phase, we could really just have a really good start on activities that were needed for implementation. And this also gave utility to completing the work along the way and keeping it connected and help really refine and reflect the vision and the impact that you want to see in the implementation plan. Will, can you tell us about skipping or fast-tracking this preparation piece and how that can lead to challenges down the road?
Yes, thanks, Mona. Since the implementation plan tells the story of how implementation of the intervention is intended to go and outlines the supports as well as the potential challenges to successful implementation. If we skip or fast-track preparation for implementation planning and do not approach it in a comprehensive and thoughtful manner, it's likely that we'll overlook and not plan for challenges that the team should have anticipated. As an example, I've been involved in efforts where we had not critically thought about the context and the possible challenges around the foreseeable negative impacts of some serious investigation backlogs that resulted in preventing caseworkers from being able to meaningfully participate in the implementation effort. So, you know, in hindsight, we should have identified, we should have planned for that circumstance. You know, my memory is that we were at a place where we weren't skipping this part of it, but we were definitely moving through fast, and we weren't being as comprehensive or thoughtful about really what was our context and what were possible challenges that we should be considering. So with that, I want to ask Joan. Joan, how do you know if we have the right team members? If new members are needed, how best can we get them up to speed on the project?
Yeah, thanks, Will. And Nicole touched on this briefly, so this is a good feed-in. But, you know, I think we all know on the line here how important it is to have the right individuals on any team that we're involved in, and for any project for that matter. But I just think it's especially true with the types of long-term implementation efforts that states are often immersed in when they're trying to bring about that fundamental and sustainable change. And knowing whether you have the right people at the table first and foremost really needs to be an intentional effort, right, on our part and on the part of our agencies. And so this means stepping back together as a team based on where you're currently at in your change continuum, and then reflecting on whether you think you have the needed expertise, the diversity of experiences and perspectives, you know, present on the team to successfully complete the task. Not only those that are right in front of you at that moment, but also the tasks that may be coming a little bit further down the road, you know, trying to anticipate new members that you may need to bring on in order to complete future tasks. So, for example, when states or agencies get to the point of actually building the work plan for their intervention, it's particularly useful, if not outright necessary, to have individuals on the team who have some experience or expertise with developing or implementing the intervention at hand, or at least something similar, since it's so important to have that perspective at the table to being able to plan out all of the different, the myriad of implementation activities. And Nicole touched on this, but I mean, the team that's formed at the inception of the process may not be or may not include the people that you need to have there as you move along. So, it's also, just if, for example, when states get to the point of actually building the work plan for their intervention, it's important to have the perspectives of staff or agency partners represented on the team who are going to play a role in delivering the intervention, as well as intervention or individuals such as parents or youth who may be the primary recipients of the intervention. And I think the central point on this is simply that the membership of the team needs to evolve, and the agencies really need to be conscious of this. I think the second part of the question, Will, was in terms of bringing new members onto the team and then getting them up to speed on the project. It really comes down to having, a solid, structured onboarding and support process in place for new members, and, sharing and then taking the time to walk through, for example, the team charter with new members can serve as a useful tool for this purpose. Team charters, ideally, should contain all of the key information that would potentially provide a good overview to a new member of the team's work from its inception up to this point in the implementation planning process, including members' roles and responsibilities. And I'm familiar with a state that developed a short video as an example. It was designed specifically for stakeholders, external stakeholders who really didn't have as much familiarity with the state's child welfare system. They were asked to be part of the team, but it provided those stakeholders that were asked to serve on the team with a nice overview of how the child welfare system is structured and its primary functions. And some of that kind of basic information can kind of take the anxiety a little bit, or the just the anticipation of what their roles are going to be on the team. And just one other strategy that I've seen used pretty effectively, and this is pretty basic, but again, it goes back to what I was talking about being intentional, which is to pair new members up at the very beginning when you're bringing new people onto the team, and with experienced team members who've been kind of along for the ride and who can provide that important initial support as well as ongoing support throughout the rest of the process.
Thanks, Joan. I love that video example, and just an opportunity for, to consider how you can bring additional stakeholders on, that they don't necessarily have to be on every team in every meeting from the very beginning. I think that's a great idea. So we're going to move on and get into the next section of our presentation today, and we're going to talk a little bit about reviewing readiness findings. So we know that readiness is really critical to successful implementation efforts. And teams should review their readiness findings. When they do, it will help them identify any general or intervention-specific needs that might interfere with their implementation efforts. It also can help them identify any gaps in motivation to implement the program, policy, or practice, as well as what strengths can be used to support. Identifying these key items can help the team to effectively prioritize and target resources where they're needed most to move forward. It's important to remember that building capacity is really a dynamic process. And while the agency might be able to address some items quickly, others might need to be developed over time. When reviewing readiness findings, teams may find general needs, for example, their needs for an effective human resources system to recruit staff, as well as intervention-specific ones, like the needs for processes to recruit staff that have expertise in that specific model. Teams should carefully consider any of their findings about the organization's motivation, looking for any potential incentives for staff or other stakeholder groups that would help support intervention implementation, or disincentives that might make it more difficult. It'll be important to identify strengths that can support building capacity or increasing motivation and buy-in. For example, are there any program champions who can act as advocates, or strengths that offset any potential barriers or challenges? For example, are there external partnerships or expertise that can support ongoing training while internal capacity for training is developed? After teams review those readiness findings, they should move on to developing strategies for building capacity. These strategies should support effective implementation of the selected intervention, and teams will integrate them into their work plan, which we'll discuss in a few minutes. The strategies can come from a variety of sources, as you see there on the left-hand side of the slide. It can come from team members and other stakeholders. It could come from other peers or other jurisdictions that have addressed similar issues. It could also come from intervention developers who have experience in different settings. And then also the literature, the body of literature on capacity building and implementation. Decisions and plans for capacity building will be influenced by their existing capacity as well as other external factors like their available time frame and where and how the teams plan to introduce the intervention, whether it's through pilot or staging or statewide. The Capacity Building Collaborative has organized different aspects of organizational capacity or competencies into 5 broad categories. As you see there in the middle, they can kind of be used as a framework for considering needs and identifying strategies that meet those needs. Organizational resources are those concrete and tangible things. For example, leadership stability, staff recruitment strategies, or workspaces that really support the intervention's needs. Organizational infrastructure are the systems, the structures, policies, and protocols that help the agency function. Things like job descriptions and performance indicators that reflect new skills, even changes to the data or communication systems that will support the needs of the new intervention. Knowledge and skills are the expertise and competencies needed, for example, strategies to increase skills for management, to increase skills for frontline staff, and also to increase capacity to support data collection. or strategies that help support the agency to monitor and evaluate the intervention. Culture and climate aspects are the shared norms, values, and attitudes that influence how people accept and support change in the agency. Things like whether there's buy-in across all levels, and any strategies that communicate or reinforce the shared vision that they have in implementing this intervention, as well as sharing early successes. What's going well, what's positive about it. And then the last one there, engagement and partnership strategies. Those support relationships within the agency as well as with external partners like youth, families, and the community and our system partners. Some examples of these strategies include networks that help with information sharing across systems and really taking time to meaningfully engage a diverse stakeholder group in those planning teams. So an agency might have the capacity to implement a program or practice, but without motivation or willingness, it's not likely to get off the ground. As part of capacity building, teams should really identify strategies for strengthening motivation, including a variety of different messaging strategies. Those kinds of strategies that help increase motivation to implement will build on and really complement each other throughout the change initiative. For example, some complementary messaging on how an intervention aligns with the core values and complements existing practices, how it addresses the needs of the target population, and then making a clear connection to how the intervention will support agency and program goals can help. Strategies and messaging that reflect shared norms and values and attitudes can really help to strengthen motivation. For example, how is the intervention compatible with the agency? And what's the relative advantage of this intervention over other options or current ones? What makes it manageable or doable? Can it be broken into smaller pieces, or are there practices or processes that are comparable to existing ones? What are some of the outcomes that other jurisdictions have experienced? And what early indicators are there from any testing or piloting of the intervention? Messaging should be consistent and really reinforced in a variety of ways and in a variety of settings, and include different stakeholders. For example, you should reinforce messaging in training sessions, in meetings, as well as through emails or supervision. So I want to get back to our panelists again, and I'm gonna start with Joan this time. And Joan, regarding these last few slides here, I'd like to ask you what steps agencies might take to understand readiness if the findings they have are more broad organizational readiness rather than intervention specific. And how are they different?
Okay, so thanks, Nicole. And I think what I'm going to do is start with the second part of your question and then go back to the first. So, both types of readiness are important when it comes to implementation planning and capacity building. However, they are different. Organizational readiness is really a broader assessment of the agency's overall readiness for change. And so it reflects the general foundational capacity of the agency in terms of how it currently functions and its potential to initiate and sustain any type of change, as well as the general motivation and willingness of individuals within the agency to embrace that type of change. Intervention-specific readiness is referring more to the agency's readiness for implementation of that intervention. So it reflects the agency's capacity to implement a specific intervention at that time, and then the motivation and willingness of staff and stakeholders to adopt that intervention as their own. And this is a challenge for some states and agencies, as we know, in part because conducting a formal readiness assessment is a newer concept in our field, and it can require a significant commitment of agency time sometimes, as well as resources to do it well, and to produce the type of results that the agency is going to need to support implementation planning. So the first part of the question that you raised, Nicole, to the extent that an agency may have already conducted a more general readiness assessment that has yielded for them some useful results to inform, more general implementation planning, an agency might be able to leverage that earlier foundational readiness assessment work by using other types of data collection methods such as surveys or focus groups to gather additional and more current and more targeted information that gets more specifically to the agency's readiness to implement that specific intervention. And then the team can come together and review kind of both of those sets of findings, the previous foundational work that was done, and then what you gather from additional data collection methods, and then hopefully come to consensus on the agency's readiness to move forward in terms of the intervention. So I'm going to go ahead and ask Will then another question here. So oftentimes it's easier to identify the activities that will support building technical capacity, and more challenging to identify those that will adapt or will build adaptive capacities. So how can states kind of consider both technical capacity and adaptive capacities, even if some of them are going to be more long-term efforts?
I don't know if you're muted or not, Will, but Joan, would you be willing to jump
Yeah,
in
no
talk a little bit about that?
Yeah, I know Will is remote right now, so he might be having some technical issues.
It's okay.
So, yeah.
Definitely.
So,
we can circle back to him.
Yeah, no problem. So I'll answer my own question. But yeah, similar to kind of the preparation work that we've been talking about, building organizational capacity really needs to be approached in a comprehensive and a thoughtful manner. And a good way to do that is to utilize the 5 broad categories that Nicole was discussing earlier: organizational resources, infrastructure, knowledge and skills, culture and climate, and then engagement and partnerships. And some relevant strategies that might be more straightforward that are addressing more technical capacity issues, such as workspace being available to support the intervention, or specific devices being purchased and made available to support practitioners. Sometimes taking steps to build adaptive capacities include like encouraging, trying to encourage buy-in across multiple levels of the agency for the intervention, or engaging external stakeholders that may be predisposed, to oppose the intervention, or even sometimes be hostile for the agency. They can be critical to an intervention success, and sometimes this is time-consuming and challenging. So states can do this work, by being methodical and purposeful, by focusing time and effort on these types of considerations in their strategy development. So I think a second part to the question, I think that we were going to throw to Will, but I think there's probably technical issues here, is just kind of asking just in our experience in terms of, what we've experienced in our work, like what parts of planning for capacity building, are we seeing that perhaps were skipped over or maybe fast-tracked that ended up leading to challenges down the road. So some of the things that we've seen, I think, is, more than once being involved in implementation efforts where we really didn't effectively do the early work around ensuring organizational infrastructure, making sure that that was put in place so that, meaningful performance indicators reflecting the new skills that were developed in a way that the indicators would be easily understood by the people involved in the implementation effort. And then consequently, necessary changes weren't made to the data system to, timely and effectively gather information to inform the intervention's implementation and impact.
Thanks for jumping in there, Joan. I think we had a question for Mona too, though, right?
Yeah.
Mona, what are some ways that agencies can repurpose or leverage resources from other initiatives in order to support implementation of something new?
All right, thanks, Nicole. Yeah, the first thing that comes to my mind is really around communication. Communication plan activities are great places to leverage current resources, as there are usually a lot of meetings at different levels of an agency occurring across the state. It may be dependent on timing and flexibility of agendas, but these opportunities provides opportunities for messaging, connections, buy-in, and even identifying champions for the work. Even if you align the communication plans with other initiatives that are already implemented, it could be a way to message how the two initiatives are aligned, or how multiple initiatives are aligned or connected, and then build upon each other to improve practices. I've known some states, too, that have leveraged their teaming structures, utilizing a team that is already established but can easily be repurposed as an implementation team. Stakeholder groups are another kind of forum to leverage. Most stakeholder groups, or sometimes stakeholder groups, convene routinely and can be accessed throughout the year to discuss and engage about interventions and what to expect. Leveraging these groups as a part of the communication plan helps from trying to convene people who already have standing meetings and really not interested in having one more meeting. It's just a way to kind of, engage with them and become a part of the agendas as a part of their standing meeting. A big payoff for engaging your stakeholders and community in this way is that there may be things you had no idea about that they would be willing to bring to the table with implementation. Once they are engaged, they may become champions of the work or other resources that are needed to successfully implement. Really engaging them to share in the work. I mean, there's challenges to that too, but it really can be a positive impact on your implementation. Another area that I think about that I've seen states have kind of leveraged is in regards to practice profiles. Some states already have practice profiles developed for other programs or models that they've implemented or in the process of implementing. So being able to leverage those, something staff are already familiar with, and integrating or adapting them and utilizing them for this initiative would be great. Then you don't have a lot of different practice profile documents that staff are trying to keep up with or use, but they are aligned and they're aligned with the work that they're currently doing. I've also seen states that have leveraged current resources in regards to their evaluation, QA processes, and specifically CQI processes that needs to be established so that you know what is working or not. Those are great forums to kind of leverage in regards to, implementation activities around monitoring the work and knowing when you need to relook at something or analyze your data again or really even dig deep and figure out why something is not working and why it is. I think too, although I think there's challenges in regards to this, many times your training schedules that are already established on ongoing training or even training of another initiative are a way to leverage resources. Integrating the training or adding a half a day to a day while staff are already scheduled can be helpful. This also connects the work and how strategies work together or can build off of each other. You need to be mindful and intentional about information overload, but there are trainings that will be, but there may be trainings that would build that capacity support to prepare for the implementation.
Thanks, Mona. That was a lot of really great strategies that can be used, particularly when resources are thin, right? So thanks for sharing all of those wonderful, wonderful strategies. We're going to move into the last section of our presentation today, and we'll have one more panel after this and then a couple of other slides before we move into our breakout. This kind of gets into the meat of the brief, around work planning. So the work plan for implementation really provides a detailed account of all of the tasks and activities that will support implementation. And team members really should develop a consistent framework for the work plan that outlines key tasks or activities that will help prepare the intervention for implementation and document all of the projected timeframes for the task, any notes on necessary preconditions or interdependencies between tasks, and also the sequencing of steps. For example, does some level of training need to occur before coaching and supervision of the intervention can be outlined? As well as milestones, so any products or indications of completion, and the individuals or groups that are going to be responsible for completing those tasks or activities. It's just as important to plan for the agency to be prepared for a change effort as to ensure that the intervention or change effort has everything it needs to be implemented successfully. If the intervention is ready and the agency is not, the implementation efforts might be delayed or put on hold until those critical supports are in place. And vice versa. If the agency is ready but the intervention is not, there might be delays until those key things are in place and they've been reviewed by key stakeholders. So the team might have all of the necessary supports for preparing the intervention, particularly if they've selected a well-defined one or they've done this work in a previous step. Teams really need to ensure that there are clearly defined core components and that all components and materials are adapted to their target population if needed, and that they've been reviewed with team members, members of the target population, and all of their system partners. The National Implementation Research Network, or NIRN, outlines some key supports or drivers that are associated with successful efforts. And there are two critical areas that really can support getting the agency ready. It's the ability of workforce to carry out the intervention and creating the necessary conditions in the agency to support it. So some examples of those supports that focus on the workforce ability include a recruitment and selection of staff to manage and deliver the intervention, training for staff and supervisors, coaching for staff to practice and apply skills, assessment protocols to monitor whether the implementation is happening as intended, and support adjustments when needed. So some examples of supports that focus on creating those conditions or the environment that's needed include policies and procedures to really guide the intervention, as well as new ways of doing the work. And then data collection and reporting systems. How are they going to monitor implementation, and how will that inform decision making? And then lastly, the communication processes to really engage our system partners, our stakeholders, and youth and family in the process. So the next piece is really work plan activities around rolling out and measuring the implementation. When teams begin building the work plan for rollout and measurement, they should follow kind of that same framework that they've developed. But they also need to identify and incorporate their strategies and activities that will support any initiation of the rollout, any testing, or even expanding the intervention over time. They should identify those key activities, strategies, and plans in the following areas. So the site selection and preparation, where are they going to start it? Initiation of service delivery, including those processes for referrals of the target population. How are we going to refer for them to receive our services? The rollout of the new practices, and also coordination of services between different sites or different programs, as well as ongoing training, coaching, and staff feedback and development, and then fidelity and quality assurance processes. During the planning phase, teams need to decide where they will begin to implement the intervention. For example, will they start services in one or a few selected sites? Will they stage and roll out by region or even launch statewide? They need to take into account a variety of factors when deciding which path to take, including the purpose of the implementation, whether there are any related mandates and timeframes they have to adhere to, and then the agency's capacity to do it. They should also consider whether the selected intervention is previously untested, or is it a scale-up of a well-established model? What kind of time will be required with either of those? Does the intervention have a strong history of implementation in other jurisdictions? And was it successful? Is the intervention one that's easily spread through a train-the-trainer model, or does it require a more intensive effort, such as having a developer available at each site? Teams should think about whether it's feasible to test and make improvements to the intervention prior to full-scale implementation, for example, using usability testing or pilot testing. As part of implementation planning, teams should also identify those activities related to the following. So collecting data to monitor fidelity. Is the intervention being delivered as it's intended? Identifying and tracking indicators of short and long-term success. Planning for evaluation of outcomes. Planning for sustainability. And then considering how the data collected will be shared and who it will be shared with. At this stage of developing the implementation plan, teams may not have finalized plans for evaluation and sustainability, but they can outline key tasks and timelines for developing those plans. What is critical is that strategies to monitor and evaluate implementation are planned and intentional, and not an add-on once the remainder of the plan is developed. Communication strategies should align with and really build from the team's communication plan and their external communication strategy that they've developed. They should plan and document strategies for engaging and communicating with their leadership, with staff in the agency, as well as all of their partner agencies like the courts or community organizations, individuals involved in referrals, service delivery, or implementation support. They should talk about the target population members, as well as potential and actual service recipients, and then any other key stakeholders in the community. When developing those communication and engagement strategies, teams should try to strengthen motivation for implementation and really build a receptive organizational culture and climate. They may need to think beyond just keeping groups informed and really consider how they can shift attitudes and build buy-in and support. For example, thinking about the intervention and implementation effort from a marketing perspective and delivering those targeted messages through a variety of different channels. They might want to get some feedback from their stakeholders on those messages as well. Targeted messages can really support shifting attitudes or building buy-in that are specific to readiness findings. And then to complete the implementation plan, teams will want to pull together all of the information from the sources that they've gathered and integrate it into a cohesive document, ensuring that all of the necessary action steps are documented along with timelines and milestones and really reflect all the work they've already done, for example, with the theory of change. They want to check for consistency across sections and address any gaps, and review the sequencing of activities to make sure it's logical and there's a reasonable flow and that those action steps reflect their available resources. For example, if there's multiple sites or multiple interventions, they should consider whether they're sequencing to build on and support each other and not overwhelm those who are providing or receiving services. In partnership with stakeholders, teams should identify potential barriers or challenges to implementation, any associated risks, and outline some proactive strategies to address them. Barriers might include things like a leadership turnover, changes in anticipated funding, competing staff priorities, or another obstacle that kind of slows down their plans. The risks are how those barriers or challenges might impact efforts. And then potential solutions are some identified strategies that they could take to keep the plan moving forward in the event that one of the barriers actually occurs. Bringing stakeholders into this process can really support smoother implementation. It also helps to increase motivation and buy-in for the process and bring in vital perspectives on how implementation might work. It's important for teams to remember that even when the majority of the work for the plan is finished, it can still be further refined and revised over time as new developments occur and related plans are developed. They should consider the audience that the work plan is intended for. For example, they might choose to prepare a more formal version of the work plan for leadership or funders and a more informal working document for the team to revisit as the implementation progresses and really adapt it as needed based on their lessons learned as they progress. I want to turn it over to our panel to discuss this last section of slides. And Will, are you back with us?
Nicole, can you hear me?
I can. Great. I'm so glad you were able to rejoin us. So I wanted to ask you what actions an agency can take that will help integrate a new intervention into existing practice models or the agency's current way of work.
Okay, so as a part of work plan development, in an effort to get the agency and intervention ready, the implementation team should ensure they've engaged the appropriate agency members, stakeholders, target audience members to review intervention materials to ensure that the new intervention is complementary to an agency's existing practice model or way of work. And that's the time to identify if there are any concerns, and if there are, then these are very much the types of challenges that should be identified and addressed in the implementation planning process. And, you know, this is where the implementation team needs to be thinking about, you know, is there a need to engage other purveyors, other technical assistance providers, you know, to be able to talk about coordination needs, to be able to address any anticipated incongruencies based on that review.
That's great, Will. And one more question for you. How can they be intentional about preventing duplication and overload on expectations for staff who deliver that intervention?
Yeah, and this is where, again, being very thoughtful by the implementation team. If the intervention is well established, if it's been implemented in other jurisdictions, then the implementation team can definitely gather information regarding the impact of the intervention on delivery staff in those other settings. Checking on duplication with existing practices. Are there unreasonable additional expectations that came about because of the new intervention? And then, no matter if the intervention is well established or if it's previously untested, the implementation team really may want to consider usability testing or pilot testing to assess and to determine, if there are threats of duplicated work efforts, what type of expectations the new intervention, how that comes across with delivery staff, how does that impact their daily work? Is there an overwhelming nature of the expectations? And this type of testing will help the agency make improvements to the intervention and prevent or minimize, those concerns about duplication or an overload of the expectations for delivery staff. So let's move to another question here. Joan, in your experience, what critical components of a work plan may have been skipped or not fully developed that led to challenges down the road?
Yeah, sure, and thanks, Will. And I think this really builds on just the conversation that we've kind of laid out here for today. So some of the areas where I've seen less attention paid to, but this doesn't mean that it's been completely skipped over in some states or agencies. It's just sometimes not as detailed maybe as it maybe should be, which is around documenting the preparation and capacity planning components of the work plan. So in terms of preparation activity, again, it's similar to some of the things we've been talking about today. So for example, team membership not, being kept current, very, specific to where the agency is right now in the change and implementation process. And this is where I think just team charters are not always being utilized as well as they can be, or just being kept up to date, frankly, which again can create challenges when you're needing to bring new people, members in to the process and then having to orient them very quickly because you're ramping up very quickly to the process. Other critical components that don't always get as much attention, I think, in work plans include the team's use of readiness findings. And, we're looking at some of the comments in the participant chat here. So just in terms of identifying strengths and challenges, and then from that being able to develop strategies that address those capacity building strengths and challenges and support the implementation of the intervention. So, I think a lot of times, and I'm thinking this might resonate with you all, is just work plans sometimes just wind up focusing very much on identifying the intervention activities and the tasks that need to be completed and everything that goes with it, the time frames, the people that are going to be responsible for it, and then the measurement strategies. And all of those things we know are really important. But I think where this creates a challenge down the road is where, we wind up struggling a little bit to implement the intervention as planned because we didn't take the time to really consider the implementation supports that would be needed because maybe they weren't fully assessed, or we didn't take the time after doing the readiness assessment to figure out what those strategies needed to be. I've also, seen examples where work plans aren't really thoroughly documented. And this gets to kind of where I started on this, where from the very beginning, just thoroughly documenting what needs to be in them. And then more importantly, I think, is just maintaining or updating those work plans over time. And this type of thing can really lead to a challenge down the road for some of the reasons that we've been talking about today, which is namely that the change and implementation process that most of us are engaged in with the states that we're working in is oftentimes a very long road, and it can play out over an extended period of time. And during that time, the membership of the team is going to change, and a million things can change in the agencies, not just leadership, but, management over different, program areas and things like that. So ideally, in a perfect world, the work plan is being treated as a living document. It's something that gets updated continually, and it really tells the implementation story, not just for the people using it right now today, but for, the people that are going to be part of this moving forward, because we know that things are changing, that future team members, your agency staff and stakeholders as that change process moves forward. So I'm hoping that makes sense. I wanted to ask Mona then, what are some of the more successful, piloting or staging activities that you've seen included in work plans? And we'll kind of introduce this topic, but I wanted to get your impressions on that.
Yeah, thanks, Joan. I think just one particular or one key strategy that I think has led to a lot of success is when jurisdictions that needed to select regions to pilot or stage and really did a brief readiness assessment in order to make difficult decisions about where to pilot, leadership was on board, and they made a decision to pilot in a place where it would have the best chance of success. I think that's really key. Where you start needs to have strong readiness in place so that the intervention or strategy has the best chance to be successfully implemented, and the state is able to better understand what challenges or even strengths make the difference with the success of that intervention. This really helps states have data for validating needs for additional resources or focusing in on readiness and supports to prepare other regions as you stage and implement across the state. States' needs can differ in regards to this, and we know that being 100% ready is not always possible in child welfare systems. However, if you know these activities that make the most difference with a successful implementation, focusing on those and spending the time on those capacities can strengthen and provide the optimal opportunity for success in areas that may not have the same level of resources, etc., as the region where you did pilot or started in. Being able to adapt and adjust as you move to each region will be less challenging if you started where you had the best opportunity for success.
I love that example around trying to identify a jurisdiction where you think is the most ready, because that really is going to lay the foundation for whether you know if it'll work or not, right? That's great. I wanted to, before we move into our breakout sessions, we want to just kind of touch on some common missteps that we know happens often in jurisdictions when they're planning for implementation and to build capacity. So we've talked about some of the more common mistakes as we heard from our experts and with their experiences in the field, but let's recap some of them before we move into our breakout sessions. And then we'll have a couple quick polling questions as well. So one common one is really not addressing the results of the readiness assessment in the implementation plan. So as we've heard, it really is critical to address how the agency plans to either work around those gaps or build up the supports that are necessary to successfully implement and sustain the intervention. Not including all of the pieces of previous work to connect how they got there. So teams should really continue to reflect on all the work they've done in this process throughout and make clear connections to their rationale for the selected intervention, as well as the activities that they choose for that agency's unique context. Not taking time to think through potential barriers that may come up that could delay or even halt implementation plans, and really proactively deciding how to address them. When teams proactively consider all of the potential barriers that might delay or even halt plan progress and think about solutions, they're more prepared to handle them without a major delay. Not enough emphasis on communication plans, particularly for external stakeholder groups. So being intentional about those messages that both inform and shift attitudes for all stakeholders, including youth and families, will help to increase buy-in and motivation throughout the process. Using stakeholders as a sounding board, rather than really intentionally engaging them as a member of the team. Engaging all stakeholders in a meaningful way as part of the team through the process really helps to support more relevant feedback on the plan, including some of those feedback loops that were asked about, particularly for members of that target audience. And then not addressing sustainability of the intervention over time in the planning process. So thinking through the initial ideas about how to sustain that intervention over time will really ensure that the team continues to address and adapt those plans as the intervention becomes part of long-term programming. So we have just a couple of quick polling questions before we jump into our breakout groups. But this first one is a two-part. It is a short answer, so it's one that you can kind of type in a response to. We want to hear from you. What other mistakes have you seen in the development of implementation plans? And then what impact did they have on that implementation effort? So take your time. As a reminder, you'll be seeing other people's results. You can only respond once. Well, you could respond twice, but it'll override your first one. So as far as some of the other mistakes, not coming up with a way to measure progress. Yeah. How do you know if you're doing what you intended to do if you don't know how to measure it? No usability testing, poor communication. Yeah. Moving forward with implementation without the end in mind. What are your long-term goals? Yeah, definitely. Involving stakeholders after the plan was developed. Yes. No readiness survey. Not waiting long enough to see the impact. Yes, definitely. Completing the task but never measuring progress or adjusting plans. No usability testing until after installation and assuming implementation on a large scale. Planning only with administrators and not the feet on the ground. Yep. And what about the impact that they had on the implementation effort? So how did that impact the effort? The goal was never reached. It stalled achievement of the goals. A lack of reliable data that could be shared with those that were invested in the program. Lack of buy-in and support. So implementation was shortened and then it was aborted. Lowered agency morale. Lack of buy-in from partners and staff. A lot of the lack of buy-in, stalled process. It took longer for staff to become fluent in the model. Definitely. The ultimate goal was never reached. Definitely. I see a lot of these with very common connections to some of the common mistakes we were talking about, but definitely it can have a big impact. We want to take a moment to do one last poll with you today. As part of our effort to continually improve ourselves, we really want to hear about your experiences with the Change in Implementation event series. So we'd like to ask if we could contact you within 3 to 6 months with a follow-up survey. And if you answer yes, it'll be automatically connected to your name and our evaluation team will reach out to you. It's perfectly okay to answer no or no, not vote at all. But if you're willing to talk to our evaluation team about this experience for you and how we can make it better, we would definitely love the opportunity to reach out and get a little bit of additional feedback from you. So we'll leave it there for just a moment. And we appreciate those of you who are willing to take on the task. Really only takes about 30 minutes of your time. And then I am going to turn it over to Christine.
Thank you, Nicole. We are at the end of our scheduled time, so we will be finishing this webinar shortly. Feel free to contact us using our website, capacity.childwelfare.gov/states. That's capacity.childwelfare.gov/states. You can also contact us by our email address, capacityinfo@icf.com. That's capacityinfo@icf.com. Or by our phone number, 844-222-0272. Thank you for joining us, and have a great day.